Some more questions of PGI November 2012. What tumors are part of anterior mediastinum? Fortis, teratoma, thymoma, terrible lymphoma, and T for retrosternal thyroid is what you have to basically remember. Neurogenic tumor is a posterior mediastinal tumor. You are able to see spine, vertebra. The mass is closer to vertebra means posterior mediastinum. So neurogenic tumors are generally posterior mediastinal. What is the most common site of the carcinoid of GIT? With every addition of Harrison it keeps changing. The most common site. So doctor, small intestine, not appendix anymore. Small intestine is the most common location. And within appendix it is carcinoid out of the various tumors. So this is an example of a typical small intestine having a argentifenoma, which is the other name for the carcinoid tumor, is what need to be remembered. So 70% of them will originate from bronchus, jejunolium or colorectum. 70% of times is what need to be remembered. So overall GI tract is most common site, where 64% of them originate from the GI tract. In pneumoperitoneum, what are the various radiological signs that you see? Is a favorite MCQ of examiner. You don't see claw sign. Claw sign, where do you see? Intussusception. Very good. And pipe stem appearance with that cicatrization, where will you see? In case of any inflammatory bowel disease actually. So remaining things, regular, football, cupola, all the three you will see. What are you seeing here? Tell me, doctor. It's an AP radiograph. In a patient, there was a perforation, rectal perforation due to a traumatic placement. A large amount of free gas you are seeing in the front of the peritoneal cavity, like a football. You should imagine a football here because of all that gas. That is called football sign. Then what are you able to see over here, doctor? Classically this is called as the double wall sign. The border of the gut, normally you don't see. Unless the gas got leaked out of the gut, then gut के अंदर गैस है, gut के बाहर भी गैस है, इसलिए gut का wall दिखाई देगा आपको, which is then called regular. Then underneath the diaphragm you are able to find the gas, which is called cupola, is what you have to ultimately remember. Enthesio neuroblastoma. This is the rare topic. This will never be asked in any other exam. Especially bronchogenic carcinoma only, what is the age group if I ask? Okay, out of guess you will tell 50, 60, 70, kuch bhi dal sakte. This tumor itself is a rare thing, it is not a high yielding topic. Then how will you know the peak age of incidence? It is mainly to discourage people who make wild guessing in a negative mark exam. But it has a bimodal distribution. Fundamentally, two peaks of incidence, 20 and 50. Then location is classically nose because it is enthesio. That what to guess kar sakte. The remaining things, don't suddenly feel that I read somewhere VMA will be found, VMA will be definitely found, don't argue. आजकल मुझे डर लग रहा है Sunday mock test में, if 1 or 2 are stuck up that no, that is correct only, I read only means, what will you do? If you are a 4th class or 5th class children means, say, badjo, and then you will continue like our biology teacher. But yahan to you are all full-fledged doctors, and except general medicine, remaining subjects you are as good as me, in fact more good than me. So this is a enthesio neuroblastoma. classically, and it has a bimodal pattern of inheritance, and they will metastasize very widely. Examiners, one of the options was, will there be any limited occurrence without metastasis? No, they metastasize widely is what need to be remembered. What are the extraintestinal manifestations of Crohn's? A Crohn's, a ulcerative colitis.